Hi everyone, Bob Quinn here for Blue Poppy, wanting to continue the discussion about Sotai and Yin Sotai. We'll cover both here. And here I want to talk about how I approach trying to free up different sorts of blockages here in this greater lumbopelvic region. This is called Koshi, K-O-S-H-I. And one of the core principles in Sotai is that all of our movements, whether they're here in the wrist or down here in the ankle, should engage Koshi. But we can design moves where that's inevitable. The Koshi just has to be engaged. It's possible here, of course, to do it where there'd be very little engagement in the Koshi, so this greater lumbopelvic center, we'll call it. Remember that anything you can do with the body from here to here, here, everything is Sotai-able, right? You can apply the Sotai principles to all these movements. Does it feel a greater sense of ease to move this way or this way? Now you can ask the patient or you can try to figure it out yourself just by how things feel when you move them. So we can, and it was said that Dr. Hashimoto had over 700 distinct Sotai moves. Well, you can see that that is something we could reconstruct just figuring out with every finger. There are multiple moves available. But something more important happens when we engage this pelvic center. And so I've developed certain moves in recent years that I wanted to share here that I think move beyond the basic Sotai kata and get us something helpful here. Now some of them could be done in a very basic way, or we could get more sophisticated, moving into this more Yin Sotai idea where the moves engage one side and the other side of the body together. We'll see how that looks. And I'm not saying you need all of these moves, you could just pick one or two of them. So let me step down here to the feet. Now, a basic one, it would be just to be lengthening. This is a fairly standard move. So lengthening through the heel. And rather than resist this way, I usually just put it up against my leg or my hip and resist like that. But how to figure out which leg comes long and which one goes back up, I usually just pick up and push up. Now I have an easier time, I hope you can see, with this one going up. The body itself, when I introduce this movement, is showing me the direction of ease here is up. So this leg is the one that's coming long. As this one comes long, for sure, this one has to go up. So it's going to get what I tested, its direction of ease. So what I do is I start here, and we give instructions with the exhale, Ben, you're going to come long this way. But I want you to do the movement slowly, mindfully, and I don't want you to start until the moment you're exhaling. When you perceive that I'm resisting you, keep exhaling, keep trying to move until I say the word relax. Okay? So get breath in, and I start it up. Exhale, coming long, relax. Now that was actually a little bit strong for me in terms of my ability to resist, so I'm going to just refine my verbal instructions, and I say next time lighter, softer. You don't necessarily have to go slower though, that was not bad. Breath in, exhale, that's it, relax. See, his legs are lots and lots stronger than my arms. You might have noticed that while I'm resisting here, I'm slightly resisting here, because as this one comes this way long, this one for sure has to go up. So I have a little bit of drag here as well, in addition to resisting here. We come to this Froggy position. And for years, the only one I did in this position was figuring out there's up, note how that feels on that side. Let me do the movement if you would. And here, it feels tighter. So this one doesn't like, you could say, going up as much as this one. And in Sotai, we do the direction of ease. So easy here is up relative to this. Easy here is down. So we let this one come down while this one goes up at the same time. We'll start here. And let me say, many people make the mistake and they call this the move. That's not the move we've tested. We tested this move, not this move. So this is what's going to happen. So breath in, and notice my hand hold. Exhale, up, down. Relax. And then passively complete the same movement. So in Sotai, moves can be repeated, but for our purposes here, I'm just generally just going to show the moves one time. Now, here we are in this. There's something we could do without even testing at all, would be to simply bring both of them this way. Here I'd be comparing this movement to this movement. Well, virtually everyone is going to have an easier time coming this way, so we don't even really have to test it. So breath in, exhale, feet come to me, that's it, keep coming. Relax. And we want our resistance to be 2, 3, 4 seconds. And remember in Sotai, in terms of talking about the resistance, I'm following here, I'm not resisting at all. So the resistance is 0, 0, 0, 100%. What I'm doing here is just tracking, waiting for my point of resistance. And I don't have to do it abruptly and suddenly, right? You can bring it in over a short distance, but it's fairly this 0, 0, 0, 100%, basically. Okay, well, what else is available here? Here's where we put on our Sotai thinking caps. What other movements are available here? Well, it turns out there are quite a few. We have this. How easy does this go down compared to this? Oh, this is pretty hard to bring down. This is relatively easier. This one, its direction of ease is not that way, so it's got to be this way. So we start here, and the movement's going to be this way, right? So I'll be resisting here and here. Breath in, exhale, left, down, right, up. Relax. And that, of course, could be repeated. Well, what else is available here? Well, on this line here, the knee might come out or it might go back. I can reach across and see how easy is this to come out on this vector. There's movement available, and compare it here. This one feels easier. So comparing this side to this side, in these movements, this one does a better job. So we're going to let this one go out that way. Normally I would go over there, but for the purpose of the camera, I'll stay where I am. I'm going to resist here. But again, normally I would be standing like this, resisting the movement coming into me. It's okay to do it from here though. So I start you here with the exhale, you're going out there. Gentle, mindful exhale. Relax, and then passively completing it. Here there's not a lot of movement available, an inch or so for most people. So you'd only have them move a very short distance before you have to apply the resistance, or else they get stuck out there with nowhere else to go. Now on this side, the direction of ease was not this way, so it's got to be that way. So in a sense, I say I play out the available movement, and you're going to be pulling back in that way. gentle, mindful breath in. Exhale, going in. Relax. Passively completing it. Now, people get cramps eventually in gallbladder 29 there, so you have to give them a moment. And I'll show, when I'm going to get up on a table like this with a patient, I say, so first, it's okay with you if I get my knee up under your leg so I can do a little gentle rocking. I've never had anyone say no, but I give them that option. And I'll show what I would do if the answer were no. So this is the rock. My hand comes under, all the way under, not just at bladder 40, but past to where I'm outside, almost to the gallbladder channel. And then this hand joins in that rock. Well, when I'm doing a number of Sotai movements, we start at the feet generally and move up the body. It helps here and there to stop, giving commands, breathe in, breathe out, move this way, move that way, and give the nervous system a little chance to catch up, give the patient a little chance to have a break from this directive aspect of Sotai. And so here, my target here is the nervous system, not tight muscles. And of course, those of you who are familiar with Traeger body work will recognize where the inspiration for this type of move comes from. Now, what I've added to the Traeger, and this has influenced my Sotai and my Yin Sotai particularly, is the Taoist Qigong Tuina. This Yin, which in this case would be a shortening, this direction of the tissues, and Yang, lengthening. So I don't just have side to side rocking, but inside that side to side, if you can see, I'm playing up, I'm shortening. If you have chronically tight muscles, say here in the inguinal area, and you offer them a shortened position for a minute and a half, there's a good chance they're going to let go and lengthen. So I'm just offering yin, which is synonymous here with shortening. And the amplitude of the rock, I alter here and there. And so I'm not going to do this for the whole minute, but I just want to show you this is what yin looks like, and eventually the yang. Yang. Yin, yang, yin, 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 yang. Now, without getting under the knee, say maybe the patient's too large or some problem, you can still do a very similar rock here. Notice I'm not massaging as I rock. It's not this type of thing that you see in shiatsu. I have nothing against that, by the way, it feels great. But here we're not after massage. We're after having the rhythm of the movement be the medicine. So here's what yin looks like in this position. Here's the yang. Yin, yang. And this area, it does in this case actually need it. So you've given a little break, you can come back to this froggy position. What else? Well, here, I'll drop down. We can have toes to one side, toes to the other. It feels, what's your perception? You want to go this way as a direction of ease? Okay, I would have done that, yep. Breath in. Exhale, everything moving to the right. Relax. Always with Sotai, the first question if you invent a new move is, how am I going to resist it? Right, going this way. So I've got to control, I have to help the patient keep the feet together appropriately. And then how am I going to be in a position to resist? By pushing this foot into this with this hand resisting here effectively is resisting this and this both. Right, so this hand is actually pushing into the resistance, so this has the activity of both feet that it's capturing. We also here can think of heels up or down. Well, of course, most people it's going to be easier to go down, but it's still, these are different muscles that get engaged. So with the exhale, then you're going to come down. Breath in, exhale, heels down. Relax. Good. And again, you sometimes instead of saying the toes going this way or that way, I'll focus on the heels. Heels going right, left. Well, left is a lot better. Take a breath in. Exhale. Relax. The same thing as before. This hand is pushing this so that the resistance I have here captures the effort of both legs. Now, if we want to think of the more sophisticated movements of Sotai, so say we have the feet that will focus on toes coming this way, right? So we start here. So as those come this way, I want you to rotate your head this way. And I can reach both, but if you couldn't, say you have Shaquille O'Neal on the table and you're a ballerina, you can have Shaquille resist the movement up here himself. Well, we'll show that. So when I offer resistance here, you keep trying to move, but you'll stop yourself. Okay. We'll show that way first. So breath in. Exhale, head and feet going. Feet two. Keep going with the feet. Relax. But if I wanted to do it all on my own, I start here, breath in, gentle, exhale. And now I'm resisting at both points. Relax. And passively completing both. Earlier we had looked at, I'll give you a moment to relax your hips. We had looked at coming out on this vector. Well, we can subtly change that vector. Instead of coming out this way, the knee can come down this way, kind of parallel to the side. That's it. So here and here, test before we move. Which side? This one happier coming down. So I can just resist that with my hip. If this one's coming down, this one for sure is going up. So I can just reach across. Now I'm not going to hurt myself by overextending. I just want a little bit of a presence here. So breath in, exhale, relax. And then passively completing. And again, we give a little break. Can you see how much more movement we have than we did initially? More is still needed. So with the straight leg, I could resist ASIS coming up or down. We would want this one up, this one down. It would look like this. A breath in, this one goes down. Exhale, on the right goes up. I'm resisting with both sides. Relax. And then passively completing it. Or that can be done with the knees up. Same move. We'll say, actually, let me check here. Yeah, this one's still down, but I'm just going to say, think of this one coming up. Exhale. Relax. Yeah. And then completing that. But we can go back to our froggy position. A little bit more challenging. Because there's less movement available now, generally for most people. Still this one down, this one up. Breath in, exhale. Relax. So I showed the rock here. Many times with the pelvic constraint, the paraspinal musculature becomes a key player that we need to address. We can have this kind of rock, and I can tell already just rocking in this direction how tight it still is in the inguinal area. So as I push away here, my hand under is going up. This hand has got the jaw-ji line here, so the laminal groove, and I go up, up, and that hand slides down. So this is treatment, but it's assessment as well. So I'm all the way up, probably T4 or 5, and patients don't generally complain about this one. Very comfortable. And of course you would do it both sides. I won't go over there just because of camera angle. So I only got to one of those moves where I introduce the Yin Sotai element of multiple body parts moving. But I think if you start to play with these moves, I've shown that with your own experimenting, you can figure out how to bring in shoulder girdle moves this way, neck moves, and so on. That will add a degree of sophistication. And that helps us break the patterning of habitual movements, to bring in novelty, moves that they're not used to doing together, that creates new learning possibilities for the nervous system. So I think I'll stop there, having shown, I don't know, I'm guessing 5 or 6 moves, and see if you bring these into your Sotai practice, if you become convinced as I am that these are a good addition. Thanks for listening.